Hello, everybody. Welcome to the 2023 State of the School Address. For those of you joining us online, we are coming to you from inside the Dr. Barbara Atkinson Forum, inside the new medical education building, inside the Las Vegas Medical District, and we're very happy to be here. And for those of you joining us in person, thank you for coming. Friendly reminder, please silence your phones so we have a limited interruptions. So for the next 39 minutes or so, you're going to be learning about the people and programs of the School of Medicine, where we've been and where we're going. Regardless of whether you think you know a lot about the school, I guarantee you, you will learn a lot tonight. So without further ado, I'd like to introduce the Dean of the Krikorian School of Medicine, UNLV, Dr. Mark J. Kahn.
Thank you very much. So, as you can hear, I'm suffering a little bit with laryngitis. So, just put up with me. We'll be okay. So, I'm really excited. Good evening. And I'm really excited to be here in this beautiful Krikorian Medical Education building to present this year's State of the School Address. And I was reminded that this is the first time since February 2020 that this address is actually in person. So we're really happy to be able to interact. As I celebrate my third year as Dean of the Krikorian School of Medicine at UNLV and Vice President for Health Affairs, it's really my honor to stand before you this evening to share my thoughts and reflections on the past year and the vision for the coming years. And to cut to the chase, this is a really exciting place to be and a really exciting time to be here. As a young medical school, we face challenges and continue to face some, but we've also had really tremendous success. And when I look back on what our founding dean, Barbara Atkinson, and our interim dean, John Files, were able to accomplish, it makes me feel good that we've been able to build upon such a strong foundation. We have immense potential moving forward, and this is thanks to the hard work and dedication of each of you who are committed to providing high-quality educational experiences, engaging actively in research that will transform healthcare for Southern Nevada, and research that's really directed solely towards community needs. We're also going to deliver high-quality care and safe care to our fellow Nevadans and continue to contribute to the community in meaningful and positive ways. This is a team effort, and I'd like to acknowledge some of the other people who really have made this happen. We have a phenomenal leadership team. Dr. Robert Hernandez is Vice Dean for Academic Affairs and Education. Dr. Allison Netsky is the Vice Dean for Clinical Affairs. Ms. Joanne Strobe is the Executive Associate Dean for Administration and CEO and President of UNLV Health. Dr. Mark Wagnoli is the Senior Associate Dean for Faculty Affairs. Dr. Mario Gasparda Alba is the Associate Dean for Diversity, Equity, and Inclusion. Mr. Ron Bates is the Associate Dean for Finance and Facilities and Chief Financial Officer. Dr. Kate Martin is the Associate Dean for Graduate Medical Education and our designated institutional official. Dr. Gary Chen is the Associate Dean for Undergraduate Medical Education. Dr. Irma Corral is our Assistant Dean for Diversity, Equity, and Inclusion. Ms. Ann Diggins is our Assistant Dean for Student Affairs and Career Services. Dr. Sarah Hunt is our Assistant Dean for Behavioral Health Sciences. Dr. Deborah Cools is our Assistant Dean for Research. Dr. Alyssa Palmer is our Interim Assistant Dean for Continuing Medical Education and Chair of Family and Community Medicine. Ms. Cindy Stella is our Assistant Dean for Admissions, Recruitment, and Student Financial Services. Dr. Corinne Sullivan is the Assistant Dean for Curriculum. Dr. Ross Berkeley is the Chair of Emergency Medicine. Dr. Buddha Dawn is the Chair of Internal Medicine. Dr. Dale Netsky is Chair of Medical Education. Dr. Nadia Gomez is Chair of OB-GYN. Dr. Michael Daubs is Chair of Orthopedics. Dr. Robert Wong is Chair of ENT. Dr. David Dijon is Interim Chair of Pediatrics. Dr. Richard Benosa is Chair of Plastic Surgery. Dr. Lisa Durrett is the Interim Chair of Psychiatry and Behavioral Health. And Dr. Randy St. Hill is a Chair of Surgery. Really getting this medical school started, getting it off the ground, and having it continue to move forward is a team effort. And every day, I am thankful for all the people that helped to make that a reality. In preparation for tonight's address, I've been reflecting on our mission, our vision, our strategic pillars and values that we've created for this School of Medicine. We're here to serve our community. We educate our students, and we transform healthcare in Nevada. This is accomplished by delivering evidence-based, innovative centers of excellence in medical education, in research, that's coupled with high-quality, cost-effective care that improves the health of our community throughout their lifespan. We want to become an integral part of this community as we develop our academic health center and create a culture of collaboration through inclusion and excellence. We strive for excellence, we drive innovation, we serve with compassion and humility, we demonstrate inclusion, and we act in integrity in all we do. Now, one of the important things that we do is that we continue to expand our pipeline efforts, and that's to create a physician workforce that mirrors the community in which we live and serve. Our diversity, equity, and inclusion team supports an annual pre-medicine conference and application workshop to help members of our community enter our profession. They offer individual mentoring sessions for undergraduate students of color and for veterans. They offer sessions for many undergraduate students, and they work with our current students who are our best ambassadors in outreach programs such as the Future Leaders in Medicine, the Middle School Outreach Program, and the Mojave Mentors Outreach Program. This outreach is critical to our mission. Again, diversity, equity, and inclusion is that strand that holds us together, and that strand that allows us really to be excellent in all that we do for our community. As many of you know, we started the school with 60 students a class. This year, we'll be expanding to 66 new medical students. That's a 10% increase, and that's the maximum amount that we're allowed to increase without a specific LCME approval. Again, we aim to recruit students who are going to contribute to our community here in Nevada. This beautiful new building, donated by generous donors, can support a much larger class size, which will allow us to continue to grow, provided that we demonstrate that we have the needed instructional staff, clinical teaching sites, student services, financial resources, and applicant pool. As a matter of note, we had 1,560 applications last year, and we're working to develop and expand each of these areas such that at our next LCME visit, we can request an increase in class size such that by 2030, we'll have 90 students a class. Again, we need doctors, and we need doctors here in Southern Nevada. But we're not just satisfied with increasing the numbers, we're striving for excellence, innovation, compassion, and all the things, the values that we hold. This is why, even though our medical students have done better than the national pass rates in both 2021 and 2022 in the standardized USMLE exams, we continue to implement continuous quality improvement in our curriculum. For example, we're in the process of changing to a more traditional clerkship model under the direction of Dr. Robert Hernandez and his team. This model will provide students more time to get to know our faculty as they decide what careers they want to enter. And I think that's really critically important. In my previous role at another institution, I used to say to medical school applicants, if you come to a school that isn't revising their curriculum, think twice, because there's no known one best way to do things. And we need to continually work to improve our curriculum, to improve the knowledge that we're able to place on our students. By 2025, we're working to align our Year 1 and Year 2 curricula with the ACGME, that's the folks that accredit residency programs, core competency. We're also working to increase contact time between teachers and learning, expanding basic science and clinical training. We have ongoing initiatives to support our medical education programs, such as the development of learning communities. Now, I came from an institution where we started learning communities, and we have faculty like Dr. Hernandez and others who have been in learning communities. Learning communities allow students to break down into smaller groups so that they can learn from each other and so that there's increased contact with faculty, improved learning, and improved outcomes. Thanks to the generosity of the Nevada Health and Bioscience Corporation, we now have this state-of-the-art medical education building where we can put into place facilities for learning communities, facilities for clinical skills and simulation, facilities in anatomic education. All these will expand our educational efforts. We're dedicated to ensuring that our graduates are competitive for the top residency programs and discipline, and continue to celebrate successful match days like we did again this year. Let's take a look. Does that look like fun? Absolutely my favorite day of the year. As we celebrated Match Day with our class of 2023 students, we were very excited to welcome the medical students matching into our programs, coming into our residency programs. They're represented by 24 different states, Puerto Rico, and some international locations. We are extremely excited to have 24 of our own medical students staying with our own residency program. Now, per the Physician Workforce in Nevada 2022 edition, about 40% of physicians who complete medical school in Nevada are practicing in Nevada. 55% of physicians who complete residencies and fellowships in Nevada practice in Nevada. And 77% of physicians who complete both undergraduate and graduate medical education in Nevada are actively practicing here. Knowing this, we continue our efforts to expand graduate medical education in Nevada. We were fortunate to receive a small number of spots from the federal government this year, and we've been working with our elected officials to expand statewide funding for graduate medical education. The bottom line is we need the residency programs to keep doctors here in the state. We currently have 336 residents and fellows in our 11 residency programs and 11 fellowships programs, including a newly approved one-year forensic pathology fellowship created in partnership with the Clark County Coroner's Office. That program will graduate 2 fellows a year. With the financial support that was provided by former Governor Sisolak and the Office of Science, Innovation, and Technology, we are working towards bringing on board a 3-year hematology medical oncology fellowship that will graduate 3 fellows a year, and a 2-year rheumatology fellowship that will graduate 2 fellows per year. We're currently working on the accreditation process for those training programs, as are critical really for our population. We're also working on developing a 4-year anesthesiology program, and we're working in programs such as dermatology and ophthalmology. It's not just sufficient to receive accreditation. We really need to continually monitor the performance of our graduate medical education programs. I'm happy to announce that our geriatrics and endocrinology fellowships were recently reviewed and awarded continued accreditation. I'm also excited to see the Quality Improvement Program initiative within our obstetrics and gynecology program. And finally, we just went through institutional accreditation for our residencies and fellowships and received full accreditation with commendation, as we had no deficiencies. In addition to delivering evidence-based innovative medical education to our students, residents, and fellows, we continue to develop and expand our continuing medical education training for our academic community. Dr. Alyssa Palmer is currently serving as the Interim Assistant Dean for CME. Together with her team and in coordination with the Department of Internal Medicine, we continue to deliver a monthly Grand Round session, which is available to members of the school, university, and community. Dr. Palmer is in the process of preparing for a site visit to receive national ACGME accreditation for the school. I think that just happened, actually. I'm looking at Dr. Palmer. We'll hear in July, if I know that correctly. And we're also working to develop a Project Echo site within the School of Medicine. We have faculty like Dr. David Weissmiller, who is invited to teach internationally for the National Society of Family Physicians in Dubai. As both a medical school and an academic unit within a highly research-intensive university, research is core to what we do and is incorporated into all the other aspects of our mission. From December 2021 to December 2022, we increased our active awards and subawards by 50%. Now that's quite an accomplishment for a new school, and Dr. Deborah Cools, who leads our research efforts, I know has spent many late nights finishing and putting the final touches on grant proposals. In fact, we submitted 53 proposals totaling more than $167 million in ask, not in receive. But we've had 18 of these proposals funded, with more than $10 million awarded to the school and another $80 million awarded to our development corporation for the design, development, and partial funding of 2 new buildings, a clinical building and a laboratory building. As of December of this past year, we had 12 active clinical trials and half a dozen more under consideration. Under the direction of Dr. David DeJean, our interim chair of the Department of Pediatrics, Health and Resources and Services Administration, HRSA, awarded the Maternal Child Wellness Program a 4-year renewal of more than $190,000 per year. This funding supports the continuation of a life-saving program which has had tremendous success in maintaining the health of HIV-positive youth and in preventing vertical transmission from mother to child. No one has died from the virus who's been part of this program. Recently, our internal medicine department received an endocrinology grant for $200,000 to improve immunizations. Our obstetrics and gynecology department had a family planning grant, which has served over 140 women, renewed for another 2 years at a tag of $450,000, allowing the number of women served to be increased to 300. Dr. Laura Shaw, with support from lead faculty member Dr. Brandy Jeffries and residents, continues to serve as a principal investigator on multiple grants for individuals exposed to radiation fallout from the atomic testing here in Nevada. Also in the Department of Family Medicine, Dr. Alyssa Palmer, with multiple faculty and staff, received grants for advancing behavioral health care in family medicine. Our faculty not only serve as investigators on grants, they also mentor and support medical students, residents, and fellows. The class of 2025, admitted in 2022, was the first cohort to have the opportunity to participate in new research service and scholarship concentration track curriculum over the summer. As first years, they declared their interest in specific concentration, and 31 students selected the research option. Of those 31, I'm very pleased to share that 5 were accepted into external research internships at UCLA, Northwestern, the Medical College of Wisconsin, University of Oklahoma, and Roswell Park. 17 engaged in clinical research with our faculty. 3 worked with community physicians, including the Comprehensive Cancer Centers of Nevada and the Children's Heart Center of Nevada. 8 participated in translational research with UNLV investigators from the departments of kinesiology and nutrition sciences. And 2 completed lab-based projects with the School of Dental Medicine. This effort has really been led by Dr. Dale Netsky. And I can tell you one of the proudest moments in my tenure as your dean is when I was contacted by friends around the country in how our students and our school was, quote, killing it, end quote, at national conferences for medical education. We are at our 3rd annual Medical Student Research Symposium in September. Again, this is organized by the Medical Student Research Society with the support of Dr. Netsky. This year we had 61 medical student research posters, 5 podium presentations, and a keynote presentation by our chair of plastic surgery, Dr. Richard Benosa. Now, medical students are not the only ones who benefit from formalized research. The Department of OB-GYN has a residency research curriculum, and our Office of Research continues to offer virtual research seminars to enhance the knowledge and skills of our community. Dr. Batra has developed a curriculum for an elective research rotation for internal medicine applicants and has received the prestigious Elaine Old Horizon Award from the Society for Public Health for her work. Research, clinical experiences, and other scholarly and creative work results in publications, and our faculty, staff, and students have been very actively publishing. A quick search of Google Scholar lists over 200 results from our faculty and trainees since 2020. PubMed has 135 from the same period. And notably, the Department of Internal Medicine had 41, and the Department of Emergency Medicine had 11 peer-reviewed articles or manuscripts published. Surgery had 14, OB-GYN had 4, plastic surgery 3, and our medical students published 29 research articles, including case reports. Research is a mission. Research allows us to give back to our community, and even for our new school, we're growing and growing quickly. In addition to publishing manuscripts, chapters, op-eds, and more, we've been very active in presenting our work as well. In December, with her patient's approval, Dr. Ashley Pastorio from the Department of Plastic Surgery was able to demonstrate a new carpal tunnel procedure in the UNLV Health Plastic Surgery Clinic. She's one of only about 100 doctors across the United States doing this. Segments like this that appear on our local media highlight the benefits of academic medicine and those benefits that we're bringing to Southern Nevada. If you'd like to learn more about media engagement, I encourage you to visit our website and subscribe to our newsletter. Members of the School of Medicine have been active on the local, regional, national, and international scene, presenting our research. Our medical students had 74 poster presentations. Internal medicine had 4 international presentations and 67 national or local poster presentations. And the list goes on. We want to remain active in our research efforts. Just as education and research overlap with all areas of the school, so do our clinical efforts. UNLV Health, our practice plan, are able to not only provide the highest quality of care to the community, but they're also able to train the next generation of clinicians. This happens in UNLV Health outpatient clinics and within partner facilities, such as our primary teaching affiliate, University Medical Center. We also provide training at Sunrise Hospital and the VA. We have approximately 400 community faculty who allow us to expand the engagement opportunities for our learners. And our clinical program could not be successful without the ongoing support of all of these people. To create a sustainable growth model, UNLV Health is focused on becoming the employer of choice for healthcare. They're emphasizing employee engagement, focusing on physician and employee wellness, and we've added extra paid holidays for the employees of UNLV Health, and we're trying to provide a best-in-class benefits package, including paid time off, medical benefits, reasonable call schedules, market value pay, and opportunity for career advancement. All this is critical to create an environment where our practitioners and medical staff deliver a patient-first experience. In addition, the support teams continue their efforts to improve the overall patient experience. We're in the process of implementing a new patient reminder system. We're in the process of decentralizing patient scheduling to allow patients to schedule directly with the clinics and for patients to see updates in Epic MyChart. In addition, UNLV Health will be opening a new multidisciplinary clinic location later this year, and we continue to explore new partnerships as we work to hire between 80 and 100 new doctors and 20 or so advanced practice providers by 2025. This growth is not only necessary to support the education of our trainees, but it's growth that's necessary to care for our community. To better serve the people of Nevada, UNLV has renegotiated insurance contracts. We've joined in accountable care organizations. Our practitioners, including our faculty, residents, and fellows, supported over 220,000 patient visits. Our internal medicine team averages over 102 patient encounters per day. In OB-GYN, we've delivered about 2,500 babies, and our surgery team has performed nearly 60,000 inpatient procedures. In addition, we continue to try to develop new service lines. For example, our obstetrics and gynecology clinic now offers male sterilization. As one of the few residency programs to have the Ryan Residency Training Program, a national initiative to integrate and enhance family planning training for OB-GYN residents. All of this has created an environment where faculty are being recognized for their work. For example, Dr. Lisa Durrett, our interim chair of psychiatry, was recognized by Nevada Business Magazine as one of the 2022 healthcare heroes. Dr. Evelyn Montalvo, former chair of pediatrics, was named a healthcare headliner by Vegas Inc. And Doctors Avant Bartoshoglu, Mario Gaspada Alba, Amber Champion, Ken Azora, Aditi Singh, John Farris, Sandy Wahi, Nadia Gomez, Joe Biggis, Matthew Ng, Bob Wong, Rebecca Scher, David Dijon, David Parks, Micah Scheidler, Beverly Nyland, Fatali Pira, Dodds Semangan, Richard Benosa, John Menezes, Allison Netsky, Johnson Kay, Annabelle Barber, Jennifer Benosa, Dan Kiergan, Deborah Cools, and Randy St. Hill were all recognized as Castle Connolly top doctors in 2022. Folks, we're making a difference, and we're going to continue to make a difference. As you have seen throughout this address, there's overlap through all four of our missions: patient care, education, research, and community engagement. But all of it's eventually about improving the health and well-being of our community in Nevada. And for that, our students, residents, and fellows take that sense of community wherever they'll practice, hopefully here in Nevada. During 2022, we've continued our efforts to be actively engaged in the community. Dr. Josephine Sun and J.P. Viali with the Development Office raised over $2,500 for the Reach Out and Read program. These funds are used to provide books in the UNLV Health Pediatric Clinic for its patients. With the support of a generous donor, a very generous donor, UNLV Health opened a clinic within Clark County School District's Bailey Middle School in 2022. That clinic was so successful that Clark County asked us to open up a second clinic at their Family Resource Center on Maryland Parkway. We believe that we need to bring care to people rather than bring people to care, and these community engagement efforts are just critical to that mission. Our faculty physicians are tapped to provide their expertise in many ways. For example, Dr. Josephine Sun was invited to speak at the Green Valley Rotary Club on polio vaccines. Dr. Alyssa Palmer continues as Chief of Family Medicine at UMC, and Dr. David Kuykendall is Vice Chief. Dr. Wade Gall continues as the team physician for UNLV Athletics, and both he and his partner, Dr. Barnes, support multiple local professional sports teams, including our championship WNBA Aces, the Golden Knights, the Silver Knights, the Aviators, and many others. Our emergency medicine folks have increased its national presence in the field of emergency action planning and emergency coverage for major sporting and mass gathering events, providing numerous opportunities for residents' experiences, supporting Las Vegas Golden Knights, the Rock and Roll Marathon, the Electric Daisy Carnival, and others. They're developing an opioid harm reduction program, which incorporates a peer support specialist team and distributes harm reduction kits and is advancement of a resident-led quality improvement task force. Our surgery department, under the leadership of Dr. Randy St. Hill, has taken the lead with a military-civilian partnership in urban American trauma centers. Our military partnership began in 2002 by helping to sustain Air Force expeditionary medical skills by embedding Air Force medics from nearby Nellis Air Force Base into UMC, the only Level 1 trauma center here in Nevada. There are approximately 42 Air Force physicians participating in this program, with 14 of those military members assigned to our surgery department. We're helping to keep the military combat ready, again, contributing to our community. Dr. Alyssa Palmer continues to serve on the board of the Clark County Medical Society and was recognized as one of the 2022 greatest medical minds by Real Vegas magazine, along with Dr. Richard Benosa, our chair of plastic surgery. Dr. Aaron Rogers continues his service with the Nevada Academy of Family Physicians. Dr. Deb Cools was elected as the second vice president of the American College of Surgeons and will serve 1 year in an elected position and 1 year as second vice president. She's also received the Emergency Response Medicine Implementer of the Year Award from the Nevada Department of Transportation Office of Traffic Safety. Our faculty, students, residents, and fellows are recognized for their contributions through induction into Alpha Omega Alpha and the Gold Humanism Honor Societies, both national societies in which we now have chapters. As we continue to look forward, we have a lot to be excited about. While we hired 10 new faculty in 2022, we're planning to hire many more to support our continued growth. In February, I had the opportunity to participate in the 82nd session of Nevada Legislators' Public Health Day, together with the UNR School of Medicine Dean Paul Houtman and some medical students. We met with legislators. One of the medical students, Vish Ravikumar, is a student body president, and Daphne Furl were both introduced on the Senate floor by Senator Fabian Dugnate. We provided testimony regarding Assembly Bill 74, an act relating to higher education, authorizing the Board of Regents to enter into public-private partnership agreements. We testified on Senate Bill 146 that would expand providers' ability to be put on third-party payer panels. And importantly, we worked together, the dean at UNR and I, to educate legislators on the importance of graduate medical education for our state and the importance of state funding for continuing to develop GME programs and to continuing to provide doctors for our state. I'm encouraged that with our colleagues at UNR, our partners throughout the state, and our community supporters, that we're going to continue to see improvements in healthcare and medical education opportunities in Nevada. Ms. Joanne Strobe is leading our practice plan. She's ensuring that we provide quality and safe care. Dr. Allison Netsky, our Dean for Clinical Affairs, is working again to make sure that we have the necessary physicians to care for our community. We know that each and every one of you are critical to our success, and that's why on April 10th, we're going to conduct another climate survey to take our pulse, to ensure that we're monitoring what we do, to ensure that we can take the best care of our students, residents, fellows, and patients, and to make sure that we can adjust when needed so that we can reach that mission on being the premier place for health professionals to work. We are academic medicine, and with our colleagues in the School of Dental Medicine, Integrative Health Sciences, Nursing and Public Health, we're advancing academic health and the benefits it brings to the community. I want to close by thanking each and every one of you, firstly for listening to my raspy voice and for watching me spill this blue drink all over myself. But on a serious note, I thank you for what you're doing. You're making a difference in the community, you're improving health, you're improving wellness. That's an honorable task, an honorable undertaking. With Godspeed, thank you.
"40 minutes with that voice." And did he tell you what that was? It wasn't about the Red Hot Chili Peppers concert.